Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxy, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Welcome back to the show, COIQ listeners. On today's episode, I have Eran Kabakov with me, who is the CEO and founder of Dacola. Welcome to the show, Eran.
Thank you very much. Thanks for having me. Appreciate it.
So tell our audience a little bit about your background and what you've been innovating.
Sure. I'm a clinician. I'm a healthcare provider. Been in healthcare or patient care for over 30 years. The majority of it as a physical therapist. And I've been working on improving the conversation and communication between healthcare providers and patients between, or before, after, and between medical encounters, where there's the vacuum of communication that happens.
Okay. So when did you get started and where are you in the innovation process now?
So the first idea, or the first drawing for the idea, happened back in 2001. For the listeners, it's 2020. So going on 20 years from the napkin drawing.
Wow.
I was working in the clinic and I had 4 patients that were so similar. It was, since then, in all of my career, it never happened again. So it was something that meant to happen to push me into this crazy ride that I've been on. But the patients were young high school athletes with left medial knee pain. And I remember it today because it was so unique. And when I came out from the evaluation of the last one, I told my colleague, I said, I just spent at least 20 minutes with each one of these athletes saying exactly the same thing. We have to make this better. It's 20 minutes, it's 80 minutes total that we could have seen more patients, have done more things. We have to improve this. And the internet was starting. I'm a geek, so I was I was playing with the internet. I said we can do this on the internet. So I went home and I drew the idea, and I started researching, started looking around to see what was out there and how we can do it better. And really, physical therapy is my love. I love doing it. I love the patient interaction. I love helping people and getting them feeling better.
You always smile when you're talking about it.
The amount of satisfaction I get it's like nothing else.
Yep.
So it is a wonderful thing. But I found out that I have the same passion for getting the communication right in the encounter, because I've seen the patients that I've had the opportunity to really interact with and communicate with, and I've seen the patients that I haven't, and the results. So I don't have empirical data, peer-reviewed, evidence-based data, but I do have the clinical experience to be able to say those patients are doing better. So that was the nudge, and I wish I could say that it was a nudge downhill and it was like just speeding down and woo, it's like that roller coaster ride that is awesome. It was actually a nudge uphill.
We all wish that was the journey of entrepreneurship.
Right. It was a nudge uphill, and it really went from there. So that was the impetus of what it is that I'm doing today.
So what have been some of the milestones that you have achieved or reached in this 20-year journey?
Wow, I can write a book about that. The milestones. So first of all, I had to learn entrepreneurship. I had to learn technology. I never seen a piece of code before I started this, so I had to learn how to understand the technology and code and everything about it. I had to really understand uh, business management from a completely different perspective. As a physical therapist, I've run large clinics.
Mm-hmm.
I've been on teams, but there's a different. It's a completely different place to be when you're working in a company, and you're an administrator, and you have even if you're in a really large company and you're an administrator and you have a huge budget, it's still you don't realize that. Well, let me. So even if you're a big working in a big company, when you leave that nest and you go into entrepreneurship, really you find yourself on a boat in the middle of the ocean.
Yeah.
And then you have to work with a team, and it's a different experience. So
Everything about it, building something from nothing versus working in an existing established infrastructure, it's like night and day, right?
night and day,
Yeah.
night
Yeah.
and day. Yeah.
So you embarked on building something from nothing.
Yeah, and really, I'll be completely honest, it was truly an ignorant decision. Okay, I mean, it was. I'm like, yeah, we can do this, not knowing anything. It was let's roll the dice, not knowing that I'm rolling the dice.
Right.
So, and I have a lot of friends now along the journey. I've gathered a lot of friends who are entrepreneurs, and I know now that I'm not the only fool to jump. But it was an ignorant decision.
Yeah. Completely.
Yeah.
So part ignorance, part crazy, and
Lots of passion.
And absolutely, and I think for, most of us, it's almost like it's a calling. You can't do anything else. And it's just nothing else fits. You just feel like this is what you were created for.
Yes. And that's the only thing that can get you started and really keep you going.
Yeah.
And a lot of times it's also for me, I have to check that feeling, and I have to check it on a regular basis to ask myself, am I holding on to that feeling without having the right product or the right offering? Because just because I have a drive doesn't mean it's the correct drive. So I keep checking myself.
So Eran, let's kind of talk about that a little bit, because I think that is a dilemma that most, if not all, innovators face between I have a dream, I have a vision, and I'm staying so determined and stubborn and making that come to fruition, but having to be agile in the method or approach that I take to get there. So there's kind of this balance of being fixed and focused, but also being agile and flexible.
Yeah.
And in the balance of those two things, in actually getting to product market fit, which is exactly what you described. So you can have a dream and not have product market fit, not have paying customers, not have a sustainable business. And it can be confusing, because I think that culturally in this ecosystem, we continue to be told that you've got to be persistent and determined and focused and stay the course. So at what point do you know where, again, staying focused on the dream and the vision, but not staying tied to your commercialization strategy, because there's something that needs to change to actually achieve product market fit and have a scalable business?
I think that it's part of the process. But if I had to do things over again, right? If I share my retrospect, and I hope somebody catches onto it and does something better than I have, it has to start early on. And you'll hear people tell you that, oh, you have to create a minimally viable product and test it, and then if it is right. Well, it's only right at the time that you're testing it. So saying, I have a drive, I have a market fit is correct, but then Corona comes along and the market fit suddenly changes. Or forget Coronas, any number of things can happen. So my example,
Yeah.
we ended up, so I ended up sitting on that idea in the drawer for about 3 years. I wanted to be a physical therapist. I was busy learning and becoming, moving up the profession. When I finally decided to create my first product, I searched and I found this third-party product, and I basically took it and I modified it for myself and started working with it. Now, at that point, I was checking fit for me. It was working for me. So for me and my patient, it was working. That was wonderful.
Right.
But about a year later, I was sitting at a dinner with a surgeon that I knew. He asked me what I was doing. I told him, and I mentioned that product. He said, "Oh my gosh, that sounds amazing. I can use it. Can I have it?" I'm like, "Yeah, absolutely, here." So he started using it, and 6 weeks later, he came back to me, and he's saying, "This is amazing. You have to do something with this." So this is the second time where I get, now I have an objective view, not me thinking my baby works, but
right.
somebody else saying there's a market fit. And that gave me really a bigger nudge. So then I dragged my brother into it. My brother is my business partner. I dragged my brother into it, and I said, I think I have something here. So we bootstrap a minimally viable product where actually I design and work with the team on creating the product, and we start testing. So the response from the market that I get is, yeah, it's working, but I'm not able to make money with it. So now I have drive, I have product fit, and I'm not making money. So that's the really a crucial part of the equation of like, okay, how do I make money off of it? And so I when I recognized that I needed those three things in check at any given moment, I basically said, my tests will be, can I get the feedback from the client base saying, yeah, this is really great, and I cannot live without it, and us being able to make the money. That's what that's the feedback I'm looking for, to know that I'm not just driving a runaway train without going there. I will say this though, I've been doing this for 19 years from the idea, but there are swaths of land that I've ridden this train of mine into, like, without control.
Yeah.
There are times where I wake up in the morning and I do ask myself, what the heck am I doing? There's no way this is right. And people around me say the same thing. So the people that are close to you, when you're on this train, people will tell you, what are you doing? You could be doing something else, and it's no stress, but
pays the bills, right? Money coming in.
Seriously, true story. And that's when I have to look at those markers and say, yeah, I do still believe in this.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. So I think what you're describing is, again, something that a lot of entrepreneurs face is, in the beginning when we create something, I think it's really common for us to have people having an objective point of view, even giving us positive feedback about whatever we created and saying, yes, this is needed, this is awesome. We don't really get to product market fit, though, until we have piles of money pouring in from paying customers.
Yeah.
And until then, we can have I talk to entrepreneurs and innovators all day long, and I work with them, and you can have, I've seen people they're winning awards, they're winning hackathons, they're getting funding, and and this can happen for years. And so it all of that stuff is great stuff, and it's all kind of giving you some momentum and some energy that says, yes, you're on the right track, keep going. And they can do that for years and still never reach product market fit, where they can look at their bank account and go, yeah. This is product market fit. And I think most of us really struggle with trying to get from, I have a few paying customers, to I actually have like that first 16% of the market. And word of mouth is happening, where I'm not just having to tell people about my product, but people are using it, they're loving it, and they're telling everyone else about it, and people are buying it.
It's that thing that people say about moving up to the next phase, or jumping the stage between entrepreneurship and company running. Mm-hmm. Right? I think that when the time comes, and Dokola, which by the way, my company, I didn't mention before, but when we get to that point, I think that I would be more comfortable to give the steering wheel to a professional CEO who does that for a living, because at that point, that's what that is what you need. And that's one of my personal milestones along the way, was the realization, the humbling realization, that I don't know everything. I cannot do everything. You have to come to realization, these are my strengths and these are my weaknesses.
Yeah.
And my team members, when I started picking my team members, I basically wanted to find the team members that are filling up my weaknesses. So, and that's why I think it works. So yeah, that's it's important. It's an important part of the journey.
Yeah. So you've been doing this for a long time. And like you said, you can imagine actually, you don't even have to imagine, firsthand that market trends change all the time, even when you don't have a pandemic happening. Right. And we're consistent having new entrants and mergers and acquisitions, and, just the evolution of the mobile phone, and, consumer behavior, and all kinds of different, market changes that happen. Then you have the pandemic. So how has that affected your innovation journey? And kind of what are you doing differently going forward to adapt in this new normal?
The pandemic, while a negative effect on the world, for me personally, was a huge vindicating moment. Because when we went out to raise money initially, and we didn't know exactly what we were doing, and we were going after VC money, I did the VC tour, and the feedback that I got was, you're in Tampa Bay, you're far away from us, your team is all over the world, you are a one-person office, so you're not a real company, and we don't invest in this. It's like you have to have a team, you have to be local, you have to be New York or Silicon Valley. And a lot of times we got pushed out of the room because of that. We've been virtual from the beginning. It was something that I was passionate about it, because it enabled me to get amazing talent, amazing team, that we would meet like this. We've been using Zooms from the beginning of Zoom.
Yeah.
And so the pandemic hits, and suddenly everybody runs to Zoom, and everybody is talking about working remotely. And I wanted to find my email list from back then and email those investors and say, how do you like me now?
Right. Guess what? I already know how to run a virtual company, and I also know how to run a global company.
Exactly. It's like this is what we do, and we can write a handbook on how to do it.
Yeah.
So it was a big win in a way. Now, it didn't make my bank account bigger, but it made me feel a little better and about what we're doing and how we're doing. It definitely gives me a better story moving on when I do talk to other investors. But that's on the personal level. From a company perspective, we are a digital health company. We are the best platform to have asynchronous communication with patients. So that means that if you are seeing a patient on a telemedicine call, when you hang up the call, it's the same as the patient leaving the office. And at that point, the patient is alone. The patient needs information. And with Dokola, the information the patient gets is from me, the clinician, or from their other clinicians, and it's available 24/7. It's basically a clone of me available to my patients at any given time, any given moment. So it definitely increased the interest in what it is that we're doing. It also finally making our sales process easier, because when we get to a client, they understand why. Now, I will tell you, and I haven't talked about Dokola much, but our product is free. So through the journey, we've tried we have tried all of the sales processes we can find, and we read the books and we listened to blogs, and it was, how do we get this? How do we fund this? How do we make money? And we realized that we were really having a two-prong approach. We have the passion project. We know Dokola can make healthcare better, can increase access to healthcare, and help people who are at the worst part of their time, where they're not feeling well, when they're dealing with physical difficulties. So anyhow, we decided to give that for free. But in order to give that for free, we have to make some money somewhere.
Yes.
And that was our coup. We realized where the money in healthcare sits, and we licensed the technology to other companies for a profit. And again, that with the pandemic, it's enabling us to have a better conversation with our paying clients, as well as the ones who are getting it at no cost.
Yeah. So would you say that your value proposition is resonating more now with COVID?
Yes, absolutely. Absolutely. It's before we had to yell it really loud, and we would get, I don't get it. Why do I need it? Now the clinicians we're talking to are basically telling us, I have to have something. How can you help me? So it becomes a much more collaborative process than a push of a sale.
Yeah. Yeah. And I think that's really interesting too, because a lot of the health innovators that I talk to that are clinicians, that are physicians, that they come to this whole journey really very differently than just serial entrepreneurs or even technologists. And, you very often you see a problem, you're extremely passionate about solving that problem, but there isn't necessarily an obvious customer who is experiencing that pain like you see it, and it's a high enough priority that they're looking to solve it and pay to solve it. And so I can envision with these market changes that we're experiencing, that I'm hearing that there's a pattern of clinician and physician led innovation is starting to take off in a little bit of a different way than it was previously, because there's more, like you said, there's more awareness in the market need, which is obviously critical to getting to product market fit, right? We can't beat people over the head and go, this is a problem. Don't you see it? Don't you want to solve this problem? I mean, and we do, because we're so passionate about it. So sometimes we find ourselves in situations where we're trying to convince the market that there is a problem and that it's a problem worth them solving. And so, maybe now the market's catching up.
I think so. And I find that healthcare in general as a market is well, I'll use the word horrific to sell into. It's risk averse. It's very conservative. It's very regulated. There's high regulation.
Yep.
And so it's very difficult to innovate in an environment like it's a counter-innovative environment, and you're trying to bring in a solution. So if some days I wish I just created a widget that I could sell on Amazon for kids to play with, because the direct-to-consumer route seems so wonderful to me. But I'm not there. So one of the biggest problems that we have today, I don't like the word problem, I'll say challenge or opportunities we have today, to be positive with my language, is the fact that when we meet with clinicians and we say, this is a free product, the pushback is, nah, what do you mean free? I'm like, yeah, it's free. We are giving it free. And we actually are working now on doing a better job at communicating why is it free, and that it is really free. But clinicians and healthcare are used to something that would cost in a supermarket $2. When you sell it into healthcare, suddenly it's $12. Well, it's healthcare, so it's more expensive. I always say that if it's for a baby, a wedding, or healthcare, it's 3 times the price it should be. So that's just an example of when you talk about market fit. We have a perfect market fit. But what's giving us issues is the messaging, and the message is good. We are a social good startup, I would call us, right? We are trying to really change the world. We have a passion for that. And when you go to the market looks at you and says, no, you're trying to sell me something because I've been burned before many, many times. And I think that you're trying to, do something like trick me into thinking it's free.
Yeah. It's that perceived value of free too. So the freemium model absolutely is a successful business model. We see it time and time again. Typically it's when it's a utility.
Yeah.
Yep. Mm-hmm.
Yeah. And we tried many things.
Mm-hmm.
We do strongly believe in the free model of what it is that we are giving for free.
Yeah.
And we think that there's going to be opportunities to, not us monetizing it, but the community that is using the product will figure out ways to monetize it for themselves. There's definitely value built into it, because we know that today a clinician that's using Bacola, they save about 20% of the time with the patient in the room or on a telemedicine appointment. 20% per patient is an enormous number in healthcare.
Yeah.
So for them, that's the monetization. They cannot charge the insurance company for it, but there's ways for them. But anyhow, there's for now we're riding the train on the free, and we're feeling good about that.
That's great. That's really wonderful. So as we kind of wrap up here, what are some lessons learned or advice that you would share with our viewers and listeners today for somebody who's, been in this company and growing and building it for nearly 2 decades, I'm sure that when you look back in hindsight, that you're like, ooh, I could have done this, should have done this. And then, and how you're, implementing that in the next season or stage of the business.
My first, if somebody's thinking of doing it or somebody is only starting the process, I would say, beware of the sharks.
Mm-hmm.
Okay, it's definitely a startup is an ocean voyage for sure. There's a lot of sharks in the water. You are passionate. You are ignorant. I am ignorant still. You don't know what you don't know, and there's people who want to take advantage of you because of what it is that you're doing. So when you get the email about that great hackathon or the great startup program or incubator, you have to be really, really good about vetting these things out. Do not get fished. And there is the fishing in entrepreneurship. There's a whole side that is negative. So be careful of that. I've failed. I've felt for it, and I've experienced it. That's the first thing.
Yep.
The second thing that worked for me specifically is starting from the end. And what I mean by that was, initially when I just was going, I was so passionate and so driven. I was just doing it for the sake of doing it. But I never really stopped and said, why am I doing this for? What am I looking for me as a person? What is the end goal? What do I want to be? Do I want to be like to have the exit? Do I want to be on Forbes on the cover? What is it that I'm looking for? Do I want to have matching Boeing 737 in my parking lot? And so for me, once I realized that when I realized what my goal is from a family, from where I'm living, from what it is that I was doing, it really clarified what it is that I need to do with the company in order to get there. Mm-hmm. And those days when I wake up and I'm like, what am I doing? The answer becomes really clear when I look at the end. Like, wait a second. It doesn't matter what's happening right now with the boat. That's the lighthouse over there. That's what I'm going for. Just, correct the course and, focus on the personal goal, what it is that I want and the drive. And that's what helped me through all these years. That was really still is every morning is the driving force.
Yeah. And that makes a lot of sense, because having that vision and mission to guide you in your decision making helps you determine who you're hiring, what customers you do business with, right? It really becomes the lens that you can use in your decision making to make sure that you don't end up either chasing the shiny new object, or you're being so influenced by outsiders that you might reach some form of someone else's version of success, but not true to what your end game was all along.
Correct. And you know what the best example I see, and that's a very tangible. I don't watch TV much, but when I do travel, I'm in a hotel, and sometimes I end up watching something. So Shark Tank, the show. Mm-hmm. I sit there and I see the sharks offer, I'll give you, $2 million for this and that, and the entrepreneur saying no, and I'm like, oh my gosh, take it. Take that money and innovate again. Use that money. Like so. Right. The stories we hear is, oh, I exited and I made $800 million. He made $300 million. Who cares about the $300 million? You have to look. It's like what if somebody comes and says, here's $10 million, and you can take that $10 million and turn it around and do something else, or just live on the beach somewhere forever. That's fine. But if you don't know what it is you want, you're not going to know that the offer on the table is right, or the opportunity on the table is right, regardless of what it is, because you don't know what it is you're trying to do with that opportunity.
Right. Yeah.
And that's
no guiding star.
Correct. And I think that would be that would be my starting point next time.
Mm-hmm. Yeah. Yep. So what's next for Dakola? As we, we're in June now and we're halfway through 2020. What's next for you? What are you most excited about being on the horizon for you?
I think we have some really exciting relationships with organizations that are seeing the power of the technology and understand it and can open doors for us to larger groups of users. So traction is a thing, and we want to get the traction. I'm really excited about some research that we're doing, some research to show from an empirical standpoint that what we do is right, and that we are on the right path. And I think that I'm excited about some relationships in the pharma world. The pharma world is is our biggest line of revenue, and there are things that are happening. I've really seen the pharma industry change over the last 10, 15 years, and I'm really excited about how open they are to positive collaboration for helping healthcare. That's huge.
That's exciting.
Yes, very, very much.
Very exciting.
Yeah.
Well, Eran, thank you so much for sharing your wisdom with our listeners and always being so transparent and so candid about what this journey is really like. I know that it becomes very inspiring and very encouraging for all of our viewers and listeners, and so I appreciate that.
Thank you. I appreciate it. I'm on LinkedIn, so if anybody's seen it and they have a question, find me there.
Yeah. So is that the best way to get a hold of you if anybody wants to?
Absolutely. Absolutely.
All right. Sounds great. Thank you. Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.